Good afternoon. The number of new positive cases announced today, 11, gives us grounds for optimism, but we still have a long way to go. Hawaii is fortunate. We appear to be flattening the curve. Today, we received the revised guidelines for reopening from the President. Unfortunately, at this time, we don't satisfy the criteria for a phased opening. Notably, it requires a downward trajectory of cases for a 14-day period. We're making progress, but we're not there yet. So please continue your hard work and perseverance. We will get through this together. As I said yesterday, state government will no longer look the same as we move forward. There are so many personal sacrifices being made in our community to protect the health and safety of our people. And unfortunately, more difficult decisions will have to be made. Many of you have already been affected by the economic fallout of the pandemic, and you are worried about your future. Hawaii's economy is at a complete standstill. More than 225,000 residents have filed for unemployment benefits. This is draining the Unemployment Insurance Trust Fund, and we may have to look to the federal government to replenish it with additional funds. We expect to have a clearer picture of the state's fiscal situation in May. But with a drastic decrease in tax collections, we are anticipating a $1.5 billion budget shortfall. My fiscal strategy team has been working to identify the impact this pandemic will have on our state and are exploring all options to deal with the anticipated shortfall. Salary reductions or furloughs are the last thing anyone wants to see happen. I want to assure everyone that we will explore all options before making any decisions about salary reductions for government employees. We have already been looking at cost controls on the expense side. We are also looking at what can be done to access the rainy day fund. This requires action by the state legislature, and we are in discussions to determine what is possible. We are also looking at using budget reserve funds and federal monies available through the CARES Act. Government employees are especially critical during this time of crisis. We must continue to provide essential services, schools, public safety, transportation, public health, and social safety net programs. These are core functions that have to be protected. But $1.5 billion is a lot to make up, and we must look at everything, including personnel costs, which is by far the largest share of our budget. I have said repeatedly that I must lead by example. If there are salary cuts to be made, they will start with me and my cabinet members. As I announced last week, Alan Oshima is leading efforts to help Hawaii recover from this shutdown and create a new normal. He is working with my department directors as we speak, and we will be hearing more about their plans soon. During this pandemic, our normal way of life has changed dramatically. From the way we interact with each other to working from home and even going to the grocery store. It is also changing the way we seek medical care and advice. In my emergency executive order, I included a provision that would allow for expanded telehealth practices by waiving the mandatory in-person consultation or prior existing physician-patient relationship. It would enable out-of-state doctors and nurses to engage in and provide telehealth services. Telehealth is the best form of social distancing between a medical professional and a patient. It allows for the patient to seek non-emergency medical attention remotely without ever having to leave their home. And it also allows a physician or other healthcare professional to do a medical assessment and determine the best course of treatment. Today, Lieutenant Governor Josh Green and members of Hawaii's healthcare community are here to provide more information on Hawaii's telehealth initiatives that will provide residents with convenient access to non-urgent healthcare services. And let me remind you again that social distancing is the only way we are going to be able to flatten the curve. These are tough times for everyone. More difficult decisions will have to be made before we can emerge as a community, reopen our economy, and eventually return to a new normal. I want to assure you that I am working closely with our federal partners, congressional delegation, and the legislature to gather information, study options, and make decisions based on the latest information available. This is a rapidly changing environment, one that we have never experienced before in our lifetime. But in Hawaii, we are strong, and we will overcome this together. So please take care of yourself, take care of each other, and most importantly, take care of our community. Thank you.
Thank you very much, Governor. Our next speaker is Lieutenant Governor Josh Green.
Aloha, Hawaii. First, let me say thank you for sticking with us through this tough time. And I want to echo the governor's comments. I think he's right on the mark. You are doing a great job. You are flattening the curve to the best of our ability to tell every day. With only 11 new cases, the curve is looking a lot like this instead of like this. And that's a great testament to your perseverance and your self-sacrifice. So thank you once again. Today, we heard that we have 541 cases, just up 11. Stay the course through April 30th. The Gov and our team will give you updates as we go. We're here today to talk about something a little different, which is a part of social distancing, and it's a part of my role, as Gov pointed out, as part of the COVID response. We're rallying our healthcare providers today, and we wanted to share with you something that's quite unique. We're trying to always ensure that everyone is ready to get healthcare and our state is ready. Our response has to be streamlined. So it was actually quite thoughtful of the Gov before COVID struck us to be focusing on virtual health or telehealth, as we sometimes think of it. Why is this important? Well, right now, as you know, the world seems to have stopped, but our health conditions continue. And we have to get basic health care because our diabetes doesn't stop. If, God forbid, we have a cancer, that may not stop. So we have to be able to continue to get access to health care. Keep in mind also that by providing virtual health or telehealth, we can access a lot more healthcare providers in a unique way. We have 4,000 physicians statewide that are practicing any given day, but we have 9,000 physicians who are licensed. And you're going to hear about some of those additional healthcare providers that are contributing now to telehealth. Today, I'm going to thank a couple of our partners, ranging from Queens to Kaiser to HMSA, who's certainly been a leader on this, JABSOM, DHS, MedQuest, for joining us today. They're going to give you specifics about how their organizations are contributing. Remember, health is our #1 priority. This is a pandemic, and we, of course, are very, very worried about our economy. But first things first, we want to make sure people stay alive. So we understand people are concerned about contracting COVID-19. We're also emphasizing you have to socially distance, and you cannot ignore your other health needs. That's why continuity of care is critically important. We have to stay up on our health concerns. In particular, chronic disease and underlying conditions are at a greater risk. People with underlying chronic conditions are at a greater risk for being complicated or having a higher mortality rate if they get COVID-19. For these individuals, we've asked people to stay obviously at home, even though healthcare is an essential need and essential service. So continuing your care through telehealth, if you possibly can, will make a difference. You will not then have the risk of being in contact with someone who might have COVID-19. So these are some of the benefits. There was one other individual I wanted to thank and recognize, and that was Senator Schatz. Brian has been a leader at the federal level on this issue specifically, making telehealth more available, and that was also coupled with the governor's really landmark act in 2016. He didn't maybe want to mention it, but that made it possible to do much of what we're talking about today. So there are benefits. It's easy to use. Telehealth is very easy to use. We're going to remind you a couple times, however, call your healthcare provider before you click on these buttons, because not every healthcare provider is going to do it, and we don't want you to be let down if you try to go to a telehealth site and your doctor is not on that. So you're going to call their office before you click. But you're going to continue your care from home, and that's going to be special during this pandemic. Some examples of services for good telehealth. Think about it. Basic healthcare, very easy. Good health education about diabetes and hypertension. Psychological appointments, very important. We have seen an uptick in depression and domestic violence. These are very important, very good services. I want to mention one of my good friends, Dr. David Roth. He's a leader in psychiatry and telepsychiatry. He taught me much of what I know about this program. So he's one of the people that's been doing this for years. Then there's dermatology, where you can see through the screen whether you've got some nasty mole or other that really is a concern. There are post-surgical follow-ups. You may have had to have surgery, but may not have to go back to see the surgeon once again and can do it from home through telehealth. All of these things could be very important. Look, you're not going to get a colonoscopy through telehealth. Let's be honest. It's okay. That will have to be delayed slightly. However, we can still talk to you about the concerns and risks and when you need to do these tests. So, telecolonoscopy, no. Teledermatology, yes. A couple other points. As you contact your doctor, let's be clear, there may be things that you can't have attended to. Like I joked about these certain procedures which we don't normally talk about on teleconferences, but I thought because things are very stressful, we could have a joke or two. There are other needs that people will be able to express to you. So these conversations with your healthcare provider without co-pays, if you're part of the system, will be a very big benefit, and they're going to get into some of those details. We don't want people to cancel their appointments unnecessarily out of fear, but we also want to give people new options, and that's why telehealth is so important today. One more time, call before you click so you know if your provider can provide the services. And while COVID-19 has caused many concerns for our community, this expansion of telehealth is really leaping forward. It's one of the few silver linings, I would say, because it's going to be less expensive healthcare. The millennial community is very into doing these kind of things, and I think this is going to help us deal with our healthcare shortage going forward. So thanks a lot for sticking with us. Please continue to socially distance. Do telehealth if you can. It's a great way to do social distancing. And when the outbreak is gone, you can all go get your colonoscopies.
Thank you very much, LG. Our next speaker is Matthew Koenig, MD, Medical Director, Telemedicine, the Queens Medical Center.
Thanks for having me. I'm Matthew Koenig. I'm a neurologist at the Queens Medical Center, and I'm the medical director of telehealth. And I want to reiterate some of Dr. Green's statements about telemedicine. Telemedicine is a really, really important way to continue to take care of our patients and maintain continuity of care. And at the same time, make sure that we're not spreading COVID infection in the waiting room or within clinics or healthcare facilities. And there's a lot more that you can do by telehealth than you may think. As Dr. Green stated, you can't do everything by telehealth. And so it's really important to have a conversation with your physician or your clinic or your nurse practitioner prior to your clinic appointment to make sure that the treatment that you're receiving or the condition you're being treated for, that it's medically appropriate to be seen by telemedicine. Not everything can be done over video, but a lot of the cognitive, side effect management, medication management, and other aspects of medical care can be delivered by video telehealth, and in some cases, telephone calls. We're in this together, and we're all learning together. I think all businesses, as you look around you in Hawaii, are having to learn new ways of doing things. And there's a learning process for all of us. So we have to be a little bit patient with each other as we figure out how to do telehealth. On the patient side, learning to use your devices to see a physician, that's a new way of doing things. And it's also a new way of doing things for us as providers. Many of us, like myself, have been doing telemedicine for years, but other physicians or nurse practitioners are new to this, and we're learning together. And so what can you do as a patient going to see your doctor to prepare yourself for a telehealth visit? First of all, make sure that you have a device that has a camera and microphone, that you have a good Wi-Fi connection or very good, strong cellular signal, and make sure that you call the clinic ahead of time and speak to your medical staff and ask them if telemedicine is right for you and that your doctor is prepared to see you. The good news is that at Queens Medical Center, where I work, we have seen an incredible increase in the amount of telehealth that our organization is doing. In the last 3 weeks alone, we've seen a 45-fold increase in the number of telehealth visits over our prior baseline. And if you go to the queens.org website, under the Find a Doctor feature, you can see that there are about 250 physicians on there who are labeled as telehealth ready, and a phone number to call for those offices. Many of those physicians are taking new patients. So this is often for established patients to maintain continuity of care, but many of our physicians are also doing new patient visits by telehealth. And so I want to reiterate again, call before you click. Talk to your physician, call the clinic, and make sure it's appropriate to be seen by telehealth. But please continue to take care of yourselves. And together we're going to get through this. And thank you very much.
Thank you so much, Dr. Koenig. Our next speaker is Judy Moore Peterson, PhD, MedQuest Administrator and Hawaii State Medicaid Director, Hawaii Department of Human Services.
Aloha. Thank you very much for sharing that, what that experience will be like if you have the opportunity to use telehealth. As the MedQuest Administrator, we serve about a quarter of the state's population. And so it's really vitally important that we want to make sure that all of our beneficiaries have access to that important health care. We serve some of the people who are the most vulnerable, people with low incomes, the disabled, people who are blind. So it's really vitally important that we focus our attention and energies in making sure that we can reduce as many barriers as possible in order to ensure that people have access to care, especially during this pandemic. So one of those ways that we've already been hearing about is by eliminating the need to go in physically into your provider. However, during that process, what we have discovered is that many of the Medicaid beneficiaries, at least, don't have easy access to the necessary tools. They either don't have a computer, they don't have access to data, or if they have a smartphone, they don't have sufficient data to be able to cover it. So for those reasons, we've needed to seek additional waivers to be able to expand the use of telehealth beyond just the audio and visual. So one of the things that we've been able to do is to expand the use of telehealth to include by telephone. Many of the people whom we serve have at least a phone in which they can make that, have that visit. Now, obviously, not all of those visits are going to be appropriate, either telehealth via the phone or through the other means. That's why you do need to click before you, or call before you click. So that's going to be really, really essential. But it is vitally important that we were able to expand the availability of being able to use the telephone to be able to accomplish the telehealth visit. Telehealth has additional benefits in that it does help reduce the risk for not only yourself, but also for the providers themselves in contracting a COVID. So we want to make it clear that telehealth is actually available whether you're in rural areas or in urban areas, whether you have Wi-Fi or you don't have Wi-Fi, you should be able to access it as long as it's medically appropriate and your provider can accomplish that. With that, I just want to make sure that everybody knows that they can access it. Please do call before you click, and be well and be safe. Thank you.
Thank you very much. Our next speaker is Jennifer Diesman, Senior Vice President, HMSA.
Good afternoon, and thank you for the opportunity to be here today. HMSA is honored to be here today with Governor Ige and Lieutenant Governor Green to talk to you a little bit about the options HMSA has available for our members. Last month, HMSA made a commitment to expand coverage online for virtual visits with all of our healthcare providers. We have an app here called HMSA Online Care. I would urge you to download that app so that if you ever need care in the future or today, you'll be able to access it very quickly through HMSA Online Care. You also can find out more about HMSA's benefits on hmsa.com. We've expanded those benefits, and during this pandemic, we've ensured that there's no financial co-payments for you to use these services, not just for COVID-19 related visits, but for all visits. So if you need to see a doctor, a nurse, a social worker, you can do so without a co-payment on HMSA's app, HMSA Online Care. What I would also like to mention is that HMSA really wants to be part of ensuring that social distancing is a reality for our community. And so we've actually enrolled 900 new healthcare providers on our system. So it's available when you want to use it, any time of day, 24/7, with not even a 10-minute wait for most visits. One of the other points I really want to make is that if you're anything like me, the situation has had an increased ability for you to feel worried for your family, worried about your kids, your kapuna. And so we want to make sure that you know that there are over 400 mental health professionals that are available for you on this service as well. We urge you, whether you've seen a mental health professional before, we urge you to take advantage of that. It's really nice to be able to talk to someone anonymously on your couch, in your house, maybe even with a glass of wine in your hand, I don't know. But I'd certainly take advantage of it because I know we're all feeling a little bit anxious right now, and it's always nice to talk to someone. I'll be available for questions after, but feel free to visit hmsa.com or to download our app, HMSA Online Care. Thank you.
Thank you very much, Jennifer. Our next speaker, Sam Balukov, Hospital Administrator, Kaiser Permanente.
Thank you, Governor Ige. Thank you, Lieutenant Governor Green. And aloha, everybody. I'd just first like to reiterate what you've already heard from my colleagues today, that our hearts are with those who have been impacted and affected by COVID-19. And that's not just those who have been sick, but the family members who are caring for them, those who have been economically impacted, and those who have been mentally or emotionally or in any other way impacted by this disease. I'd also like to thank those who are helping to keep our society running, those in essential positions, our grocery store clerks, our gas station attendants, our postal delivery workers, all those who are in these essential roles. We applaud you and we appreciate you. If I can take a quick minute and share just a personal reflection, these things about human beings, right, our species and our society that I believe make us unique are our resilience and our ability to innovate and adapt. If you look through history, there have been many, many times where we have been caught in circumstances that are extraordinary. Extreme difficulty, challenge, trials, afflictions of various kinds. And what's unique about us is we've gotten through all of them. But not only do we get through it, but we get through it better off. We find safer ways to do things. We find more effective ways to get the work done, and we find less costly ways of accomplishing what we're trying to accomplish. Telemedicine that you've heard extensively about today is one of those ways that we do that. It is a safer way of providing health care. It's a more effective way in many cases, and it's less costly. We feel very fortunate at Kaiser Permanente. Telehealth and e-visits have been central to how we practice medicine. Because of that, in the last month, we've been able to expand that service extraordinarily. We have been able to do more, I would say, in the last month than what we've done for years previously. We have an interconnected system that allows patients and members to schedule appointments, to visit with their providers virtually. It allows them to request prescriptions and prescription refills, and we even deliver these medications to our patients and members free of charge. It allows our patients to receive this high-quality health care without leaving the comfort or safety of their living room. We appreciate, and I'd like to applaud our providers and nurses, our support staff, and our the various clinicians who have been creative and who have found ways to change their workflow and really adapt and evolve their circumstances to accommodate telemedicine. We'd also like to extend an appreciation to our patients who have embraced this. As of today, 80% of our clinic visits are done virtually. Whether that be through telephone or computer or video, our patients are able to connect with our providers through kp.org, through software applications, through phone applications, to provide, to get the healthcare needs that they have taken care of. Even within some of our specialties, many of which historically were thought of as not applicable to telemedicine, we have about 2/3 of those total specialty visits that are done virtually today. This isn't something that's easy for many patients, but we're trying to find as many ways as possible to help them to adapt and still have the ease and convenience of what an in-person visit was. But again, we thank them for their embracing of this technology. I appreciate my colleagues today and the various work that is going on to expand telemedicine and telehealth and e-visits. This is a community problem that's going to take a community solution, and I look forward to working with them going forward as we find these safer and more effective and less costly ways of providing care. Thank you.
Thank you, Mr. Baluka. Dr. Lee Wenton-Seho Lam is our next speaker. Associate Dean for Academic Affairs, University of Hawaii, John A. Burns School of Medicine.
Thank you. Aloha, everyone. Thank you, Lieutenant Governor and Governor, and to all of our partners here in the room and really our partners throughout the state. The University of Hawaii is very fortunate to continue to partner, as we have been for many years, with all numbers of health providers, our major health system partners who serve as training sites for all of our health science trainees, with our partners at the federally qualified health centers, and within our other schools of social work, nursing, public health, pharmacy, and the medical school. The University of Hawaii hosts the Pacific Basin Telehealth Resource Center, or PBTRC, and this resource center has been critical with the efforts of the governor, Senator Schatz, and numerous others to really be the resource for telehealth policy. They've been conducting weekly telehealth training, and they have a telehealth 101 clinic every Friday, and really has provided help to numerous health providers, especially our independent providers. Key partners in this effort include the Hawaii Primary Care Association, which really encompasses all of our federally qualified health centers, also Papaololokahi and our Native Hawaiian healthcare system, JAPSOM, many independent providers, and soon to be coming in partnership with our medical schools Department of Geriatrics, we'll be unrolling a lot of training out to our long-term care facilities, as well as to our foster care homes, hospices, and our other providers caring for our kupuna. The Department of Health's new hawaiicovid19.com telehealth page has a link to the PBTRC, and that includes numerous resources for providers as well as patients and families. The listing there will be continually updated, and it's already quite long because it details all of the providers throughout the state who are currently providing telehealth services. Additionally, our University of Hawaii College of Health Sciences, which includes medicine, nursing, social work, pharmacy, and public health, have also been very involved in training their students and their network of providers to make sure that all types of services, not just medical, are available to all of our patients, all of our clients, all of our community, wherever they need it. In order to help further identify gaps, though, and identify opportunities, the University of Hawaii, in partnership with the Hawaii Emergency Management Agency, HIEMA, will soon be sending out a telehealth survey to providers and healthcare organizations. This information, combined with other information that's currently being collected by the Hawaii Medical Association and several other insurance companies, will help give the state a much more comprehensive picture of our capacity and our opportunities to grow telehealth, whether it's by telephone or e-visit or audiovisual, but throughout the entire state. We know that there are gaps throughout the state. We know that areas, especially in our most rural communities, have bandwidth issues. There's a lot of access issues. And so together, really, all of us in this room and throughout the state are very, very committed to making sure that we're identifying and really working with our telecom partners and many others to fill those gaps. And we're also very excited to announce that for those patients that do not have a health provider and who do have questions on whether they could be screened or should they be tested for the coronavirus, the medical school has created a free self-triage portal. It's on covidhawaii.info. That site is also linked from the hawaiicovid19.com telehealth page. But it's an online virus screening tool, and you can go on it, and it's free to use. You can access it from any device. And it's going to ask you a bunch of different questions. The very first thing, though, of course, is to see if you're having life-threatening symptoms. Because if you are, you really need to stop using the computer. You need to pick up the phone, perhaps to call 911, but also to call ahead to your provider, let them know what what symptoms you're experiencing, and then notifying the emergency department. And also, if you're calling 911, to notify the operators that you are having shortness of breath or difficulty breathing or something. If you do not have life-threatening symptoms, though, then the screener will ask you if you have a whole list of other symptoms that could be suggestive of the coronavirus. And if you do, then you'll go through a series of screens, and it'll recommend you that you call your primary care provider first. It'll also give you a listing to numerous of the HMSA and Kaiser and Queens, Hawaii Pacific Health, and many other sites where you can already go for online televisits. But you can also choose to click the link and see a telehealth provider really within 2 minutes. And so this telehealth provider, it's free to the patient. It may be charged, if the patient does have insurance, it'll be charged to their copay. The portal's open 7 days a week from 8 a.m. to 6 p.m. And again, it takes less than 2 minutes to be connected to a provider. And so again, call before you click. But if you don't have a health provider, or if you're just not sure, should I be tested or not, feel free to use this new resource. Thank you.
Thank you very much, Dr. Buen Consejo. We now move